In the 1980s I worked in an advertising agency in London, and that's what I did after I left university and all that sort of thing. And I suppose once taught the techniques of marketing and market research and looking at things from the customer's point of view. And towards the end of the 1980s I ended up, or rather my mother ended up as a customer of care services, because she had two aged aunts, both of whom needed residential care. Their partners had died, they were very old, they lived on their own and were ailing, I suppose, getting older and older. And so, being the good son, on several weekends I'd pick my mother up and drive round and look at care homes and nursing homes. And as I say, back then, a huge number of nursing homes were owned by local authorities, and they really, really were in very poor standard, very poor quality. And eventually we found a care home for both of these two aunts, but it was about 26 miles away from where one of them lived, and I think 30 miles an hour from where the other one lived. So we sorted the problem out, but it left an indelible impression in my mind that the quality of long-term care in this country was very, very bad indeed. Then I spent 2 years in America. I left advertising. I sold up my shares in the company. We in fact sold the company to Saatchi & Saatchi. And whilst in America, it was more by luck than anything else. I just came across some really good long-term care facilities for the elderly. In America they call them assisted living facilities. And I suppose that was the light bulb moment, if you like, that in the UK I'd witnessed really poor facilities, and in the States I'd found some really good ones. So when I came back to the UK in 1992, I set up our first care company with the intention of launching really good standards of care in very interesting buildings with very high standards of food and hospitality. Almost a hotel with care is I suppose how I saw it. As I say, I'd made some money selling shares in an advertising agency, but it wasn't nearly enough. So I then visited, I think it was 13 banks. The first 12 turned me down flatly and thought I was nuts. Unfortunately, the Bank of Ireland, who were quite specialist in the care sector, actually thought it was quite a good idea. The irony is, many of the 12 banks that turned me down, we've subsequently done business with, and of course I've never lost the moment or lost the opportunity to point out to them that we're now a big successful company, and they refused to fund us in the early days. I think we built up very early quite a good team on the operations side. So I think we became very good, very expert at running care homes. And there's only so many you can build every year. After the first one we did 2 more in the Cotswolds. And I think we then appreciated that there were some quite interesting operations owned by other people out there who actually probably had quite nice buildings and quite good management, but without being arrogant, they weren't nearly as good as us. And we felt that if we acquired them, we could upgrade them and get them to our sort of standard, upgrading the staff, the training, upgrading the building. So we then embarked on a whole series of individual acquisitions of either just individual homes or very small regional groups. And I think in the course of about 7 years we did 26 or 27 transactions. So that really started building the scale of the company. And then in 2004 we really took a deep breath and we bought our largest competitor, a company called Barchester Healthcare, that was several times, not times, but it was considerably bigger than us. I think by then we had about 60 homes and they had 80 something. And it was a big, big transaction. It cost £525 million. We bought it from the private equity house 3i. And it was a very competitive transaction because lots of other companies wanted it, be it Bupa or other private equity houses looking to invest in the long-term care sector. I think it's a case, it depends who's selling the company. If it's an individual or a family, I think it's very, very important that you engage with them, you know, senior person to senior person, and don't rely on, you know, junior managers to do it. I think if somebody's selling a family business, it's probably one of the most emotional things they've ever done, having built it up over a long period of time. And I think trust is a absolutely fundamental component here. You've got to build trust. And some of those acquisitions we made that I mentioned before, it probably took 3 or 4 years to build that trust up. I'm thinking of one particular company where it did take 4 years, and they didn't really know whether they wanted to sell it or whatever, and then there was ill health in the family, and eventually they came to us and said, we feel very relaxed with you. Let's go ahead. So I think it's building of trust and doing it yourself personally. And then secondly, getting a very good team of advisors, be they solicitors, accountants, you know, because you've got to go through the inevitable due diligence, and you want people who represent you well and get on with it, basically, because time is money, and you want these transactions to happen. Firstly, we offer the best quality product. I have absolute confidence in saying that we are worth what we ask people to pay, and I think people appreciate that. And the product we sell is, you know, an emotional product. It's looking after people's relatives, and people want the best. I think that's one factor. I think the second factor is that we are a very well-run company in terms of controlling our costs. I think phrase I sometimes use is we have the top line approach to the bottom line. Our bottom line is strong because our revenue is strong, and the revenue is strong because we have good occupancy and we have good fee rates because the quality of the product underpins that. But we don't forget the bit in the middle, which is the cost, and we have our costs well under control, and that's because of good management systems, a very good IT platform. We operate on 220 sites, facilities throughout the country, throughout the countries, you know, we're in Wales, Scotland, Ireland, and at any one time, our management frame is such that, you know, I can just get any number up on my desk, or more importantly, the desk of the financial director. So we've got a finger on the pulse of it. It's about respecting people. It's about investing in people. Definitely investing in their training. So we can take 17, 18-year-old care assistant and say, if you stick with us, there's a career pathway there. We'll invest in your career, and you can end up as a regional manager, regional director. And the great thing is, you know, the company's 15, 16 years old. We really have got case histories of somebody who started there and ended up there. And that's quite inspirational, I think, to younger people. But at any one time, we've got 1,000 people in training. We've got 500 apprentices, which is an astounding figure. We actually employ more apprentices than Rolls-Royce. Apprentices in the kitchen, apprentices in the laundry, apprentices in care, so on and so forth. And every time you train someone, you build their loyalty to you. We have the lowest staff turnover in the sector across our 15,000 staff, and of those in training, the staff turnover comes down even more, halves again. So I think it is the challenge for companies in Britain is to give people a career. I'm a big believer in the idea of a big society. And I'll give you a very simple example of it. We have a business in America, in 6 states in Middle America, and the level of volunteering in our company there is enormous. It's like 5 or 6 times the level of volunteering over here. Over here we tend to discourage volunteers, not we, the system does. Health and safety, police checks, POVA checks, every sort of check. And that's true of the NHS. They don't like volunteers in their buildings, they get in the way. Whereas in America it's the complete opposite. They encourage volunteering, and it's a very good and socially meaningful thing. I also think that the sort of services we offer, we are embedded in our communities. We are a community service, and we are successful because we're respected within our communities. And that's about getting down to grassroots and getting replace big government with big society. It's a huge objective, and it's not going to be achieved overnight. But I think if you can start down that road, it's no bad thing. And I'd say I'm a big fan of the concept of social enterprise. And we've already said with parts of the NHS, primary care trusts, that we would partner with them within social enterprises. Social enterprise can still make a profit, can still pay a dividend. There are just constraints, and possibly quite reasonable constraints. Well, I think charity is incredibly important. From our company's point of view, a lot of our communities are let down by the statutory services. People can't get a motorised wheelchair from social services. They can't get their home adapted for special software if they're disabled or blind. And I think we found over the last 10 years, the foundation is 10 years old this year, that by raising money and then dispersing it in the communities where we work, we build up a very good reputation in that community, and it's adding something back to the community. Now, one of the ways we raise money is to say to our employees, all our colleagues, 15,000 of them, that for every £1 you raise, be it a fun run or a party or a bridge tournament or anything, every £1 you raise, the company will match it with £1. And that's had a huge stimulus, and it's very good for bonding of people and getting our workforce sort of working together and playing together. Because I think playing together is a hard job, ours, looking after people, elderly people, sick people. There's got to be some fun in it. And it's just been amazing this summer. We've had a fun run that raised £8,000. We've had a bike ride that raised £9,000, all sorts of things. And it's just good for the morale of people, I think. The other charity, which really has far less to do with the company, is just something I'm involved in as an individual, is firstly working with Richard Branson in Africa. He set up some years ago a thing called the Branson School of Entrepreneurship in Johannesburg, which is actually based in the building where Nelson Mandela had his first law office before he was arrested. And it's just a wonderful setting for young Africans to learn about entrepreneurship. And so I've been down there lecturing and things like that. And along the way, Richard Branson and myself hatched the idea of actually bringing some very impoverished younger kids out of the townships and giving them a year's education over here in Britain. And we chose the school where Richard had gone to school, Stowe, where my son is at school, and Stowe, the school, was very keen to be seen to be doing charitable social work. So every year for the last 3 years we've taken 5 township children and given them a year over here. And it's worked. They all go back hugely developed as human beings, mostly playing sports they've never been offered the opportunity to do. Everything from golf to, swimming, polo, all that sort of stuff, as well as cricket and football, soccer, which they're pretty good at, and learning subjects that they wouldn't be able to do back home. I think anybody who's any good at anything, particularly if you're successful at it, be it a lawyer, an entrepreneur, anything, I think there is a duty to give back. Because most of us, I was state educated in a state school, and I went to university. I was the first person in my entire family to go to university, and I wouldn't have been able to do that on funding it yourself or the family funding it. So the state funded it, and I benefited enormously. So I think you do have a responsibility to give back. I think the concept of social enterprise is a good one. Let the entrepreneur or the government institution embrace something whereby you can bring in the talents of the community, and maybe the talents that on their own couldn't do it or don't have the resource to do it, try and bring it together.